When I first came to work in Europe, I was told many times that one of the things that the European or global advocates didn't like so much was that the Americans would come here and say, well, this is how you have to do it. And I really didn't like that either, because I thought it was so disrespectful of not recognizing that every country has its own issues. As a multiple-time survivor, one of the dreams I have, knowing how the European data has every time I've had cancer, absolutely helped me choose my clinical option. What can we do? And what is that you would imagine how to enhance a working relationship between the advocates in the rest of the world and the advocates in the US, your vision of what we could do together?
To tell us what to do, it's not the right way, but to educate the patient organization how they possibly could do something, that you share the experience you have. I think that's much better to learn about your success in the States than if you want to I don't know the right word in English, but to put it really, you know, this way is the best way. So it's never happened in each country.
I'm Tamaki from Japan. I'm a Hodgkin lymphoma survivor, and this is my first time attending here to ESMO. Last year I came here for the first time, and I asked a question to Stella. Could you give us some advice how to organize a nationwide cancer support group in Japan? In Japan, there are many cancer support groups, but very individual. It's very hard. So last year, I was really impressed to see Donna and many other organizations. Your organizations are unified, and we have the same problems in Japan. We have the problems of clinical trials, less of lack of information and so on. And I'm here to learn with my co-workers. Thank you very much.
There are some common issues, and there's still in many of our countries, and you pointed out, there are patients who are diagnosed and they feel guilty and they feel they're to blame. So we really have to still face some of these issues. But where we are moving, and I don't think it's being addressed, is the issue of survivorship. A lot of patients, and thank God, are living following their cancer diagnosis, and we really do not do enough about tackling the issues they're faced with, the rehabilitation they need, the changes in their life they need. And I would personally like to see this paradigm shift to survivorship issues, and also addressing other difficult areas like palliative care, which is something we don't touch as if patients will not need it, but we are going to have to address these issues, and it's part of the reality of cancer, and we can learn from each other, I think.
In Italy, where more than 800 cancer patient organizations and more than 500 now are under the federation umbrella. The reason why of the federation is because we can speak with one voice in Italy, and we have a very strong interaction with government and parliament, and we succeeded to get a lot of benefits for cancer patients. Let's first speak about the information. We feel that information is the first medicine, because in the moment of diagnosis, the cancer patient is by himself, and very little information can be given by the medical oncologist about the future and about the psychosocial problems that now is more and more important for cancer patients. So we have, now we have one cancer patient organization that since 12-15 years is devoted to preparing information tools, and we were able to collaborate with the Cancer Backup, with the National Cancer Institute, so we could get the best experience, international experience, to adapt the booklet to the Italian problems. And afterwards, we did a lot of other information, like to tell to young men that are under chemotherapy that they can go and keep cryoconservation of the semen, and we are giving this kind of information all over, and we were able to have the 35 information point in the most important hospital for cancer patients, and we succeeded to put into the Italian National Cancer Plan the information is a major problem for cancer patients. That's as far, and we have several kind of tools. We have a booklet, we have the website, and we have also several other things explaining how you can lose the hair, how to speak with the children, and so on. And we have also DVD explaining how to do chemotherapy and radiotherapy, and we did this with the Italian oncologist, Society of Medical Oncologists and Radiotherapists. But in addition to this kind of information, I think that the most important part is psychosocial needs. And now in Italy we have the opportunity for cancer patients after several years of questioning with the parliament government. Now Italian cancer patients can get disability in 4 months, and they ask how to approach the recognition of disability, and this is one of the major questions that they ask. So I think that for advocates is very important this, and another thing that we are trying to give answer to late effect of cancer patients, and also for this we are working with the medical oncologist to answer to these very important questions.
In the rare cancer community, we very much need to work together internationally, because for our clinical trials we have so few patients that we need all of the patients we can get, and that means including countries from all over the world. Stella was talking about survivorship. Unfortunately, in many of these rare cancers, survivorship is extremely limited. In brain tumors, you may be talking about 9 to 12 months if you're lucky, although some patients do extend beyond that. So we have particularly different issues that we need to cooperate internationally on. The other thing I would like to say in regard to rare cancers is that I think we do need to educate ourselves on a global basis that rare cancers many of them can't be prevented, they can't be screened for, and no amount of lifestyle changes is going to prevent you getting a rare disease. So for rare cancers, we do need to concentrate on research and support, and that has to be done internationally if we're going to survive. Thank you.
We are addressing your topic about getting global, and that's on the topic breast health. We're trying to cooperate with other continents about breast health, and I think that's very important because that's a way to recognize risk factors to get breast cancer and get people aware, the public, women aware of where the risks are for breast cancer. So I think I support a global cooperation.
In the most personal way, I want to thank you. At the last minute, all of you getting here. Vital Options International is so committed to this effort. I hope this is the beginning of a long-term partnership